Chapter 1: Healthcare Costs on the Rise, Impacting What You Pay. According to a recent article in USA Today, healthcare spending rose at the fastest pace since 1980 in the first quarter, as the new health insurance law prompted many more Americans to visit doctors and hospitals. Analysts say the sharp increase reflects other trends that should continue to drive up both medical spending and costs in 2014. After years of slow growth, the amount consumers pay for healthcare also may drift higher. The Huffington Post notes, big health insurance companies are predicting huge premium increases next year for employers and people who buy coverage on their own, citing rising healthcare costs and new mandates from President Barack Obama's healthcare reform law. The Wall Street Journal reports companies, including United Health Group, Aetna, and Blue Cross Blue Shield of North Carolina, say health insurance premiums could rise from 25% to 116% for some people. Cost increases have been further fueled by reduced Medicare reimbursement to hospitals and doctors, causing a cost shift to patients with private insurance. So what does all this mean to you? Healthcare reform changes are projected to add an additional $76 million to AutoNation's total healthcare costs over the next 3 years, on top of inflation and current benefit cost trend. Reducing the rate of growth in healthcare costs requires awareness, action, and accountability, since both you and AutoNation share in the cost of medical coverage. While there is no single formula for lowering this cost increase, we must make changes to help control the rising costs. If we identify and understand risks up front, we can focus on better health. You can then choose to prevent chronic conditions such as heart disease and diabetes, and can significantly impact rising medical costs. AutoNation is committed to recognize and reward your and your spouse's efforts to stay healthy by offering healthy credits to lower your medical and life insurance premiums, beginning in 2015. Chapter 2: What is your MSRP? So you may be asking yourself, what is an MSRP biometric screening, and how does it work? MSRP stands for Medical Score Risk Predictor. Most of you are familiar with the AutoNation Know Your Numbers Health Bus, since during the last tour, 83% of associates got on the bus and had their biometric screens performed. We have taken that program and stepped it up a level to what we are calling the MSRP biometric screening. MSRP is the name of our new program. It was created to represent the ability for you to be aware of any medical risks that you have. The MSRP biometric screening is an assessment of 5 lab factors that are accurate predictive indicators of your risk for diabetes, heart disease, or stroke. These are the same factors scored with the Know Your Numbers bus. These factors are blood pressure, HDL cholesterol, which is your good cholesterol, triglycerides, which checks for fat in your blood, glucose, which is your blood sugar and what your body uses for energy, and body mass index, BMI. The screening will also check for nicotine levels in your blood. How does it work? It really couldn't be easier. We've teamed up with Quest Diagnostics to offer you and your eligible spouse a free biometric screening that will give you a comprehensive look at what health risks you may have. This quick and easy screening takes a more in-depth look at your risks, and depending on your MSRP, you could save thousands of dollars off your medical and life insurance premiums. But more importantly, it could save your life. It's easy to participate because Quest Diagnostics will be on site at many AutoNation locations several times this summer. Plus, if you can't make it to one of the on-site events, you can get the screening for free at a Quest Diagnostic Patient Service Center nearest you. There's a simple blood draw, the same that your doctor orders for routine preventive checkups, a few measurements, and a blood pressure check. The whole process takes less than 15 minutes. Within 3 to 5 days, you can go online to see your results, and within 2 weeks, you'll get a confidential report of all your scores. These numbers make up your MSRP, your risk predictive score. The report will be mailed to your home. And of course, your report is for your eyes only. AutoNation does not get a copy or have access to your confidential results. Chapter 3. Why MSRP biometric testing? The ultimate goal of implementing biometric screenings is to improve awareness, identify health risks so you can improve your health status, reduce health risks, which leads to reduced healthcare costs. By offering the biometric screening, you and your spouse can become aware of health risks you otherwise didn't know you had. Over 27% of diabetes goes undiagnosed. High blood pressure, also known as hypertension, is the leading cause of death and disability in the U.S., leading to hundreds of thousands of preventable heart attacks, strokes, and failed kidneys each year. Strokes are the number 4 cause of death, according to the American Heart Association. Diabetes and heart disease continue to drive significant claims dollars and lost workdays for AutoNation. The average cost of a healthy person is $3,000, compared to an average cost of $8,600 for individuals with diabetes and $22,000 for individuals with heart disease. Less than 2 in 10 AutoNation associates go to their doctor for a preventive checkup each year. AutoNation is not alone in offering biometric screenings. 55% of large companies offering health benefits report offering biometric screenings, according to a 2013 Employer Health Benefits Survey conducted by Kaiser. Chapter 4. What's the financial advantage of taking the MSRP biometric screening? Just by being screened by September 30th, 2014, you will be eligible to choose from the full array of medical options available later this fall when you enroll for your 2015 benefits. You will also earn $200 in annual healthy credits for you and another $80 for your covered spouse that will further reduce your medical premiums. Additionally, you will be able to dramatically lower your monthly medical and life insurance premiums. This is how it works. 1. If based on your screening results, you pass 3 out of the 5 MSRP biometric screening components, you will be eligible for a 30% healthy credit off the expected medical cost. And if you don't use tobacco, another 20% for being a non-tobacco user. These same discounts apply if your spouse is enrolled in the AutoNation medical plan and passes the MSRP screening and does not use tobacco. These discounts can equate to thousands of dollars off your medical premiums. 2. You might be thinking, what happens if I have 3 or more biometric risk factors and/or use tobacco? The good news is, you and your spouse can still earn healthy credits. Here's how. If you have 3 or more MSRP biometric risks, you will receive a system-generated email from the Benefit Connection with instructions on how to achieve the MSRP healthy credit. You will need to see your doctor and have your doctor complete the MSRP Biometric Physician Affidavit form. After you visit, fax or email the affidavit together with a copy of your receipt showing what you paid for your doctor's office visit. All the instructions are listed on the form. If you submit the form by the deadline noted with your receipt, you will receive the full reimbursement for the visit and obtain the healthy credits towards your, and if applicable, your spouse's medical premiums. If you are a tobacco user, you will receive a system-generated email with instructions from the Benefit Connection on how to achieve the non-tobacco credit. You will need to complete a free tobacco cessation course online with the American Lung Association and submit the certification of completion, together with the tobacco affidavit form, via fax or email. All the instructions are on the form. If you complete the tobacco cessation course and send in the required information by the deadline, you will receive the 20% healthy credit off your medical premiums. The same process applies if your spouse uses tobacco. Also, in those rare cases where you or your spouse may be unable, due to medical reasons, to have a lab blood draw done, you can contact the Benefit Connection at 1-877-550-2363 for further information on how you can still qualify for the healthy credits. Chapter 5. How do I schedule my MSRP biometric screening appointment? We've made that simple too. Just go to www.msrp.net, the exclusive AutoNation Health Credit website. Click the Schedule Your MSRP Biometric Screening button. Enter your unique ID number. Your unique ID number is the last 4 digits of your Social Security number and your date of birth in the format indicated on this page. Enter your date of birth and indicate yes if you are an AutoNation employee or no if you are the spouse of an AutoNation employee. Then click Submit. Review the information shown on the screen to ensure it is accurate. Then create a username and password. You will need your username and password to access your account information every time you log on to this site. Next, click Schedule Your Screening. Read the consent language that appears on the screen and click I accept to continue. If you do not click I accept, you will not be able to schedule your biometric screening. You can schedule your biometric screening at either an AutoNation dealership that is hosting an on-site event or at a Quest Diagnostics Patient Service Center near you. If you select Attend a Wellness Event at your organization's location, you will see a list of dealerships that will be hosting the on-site events. You can schedule your screening at any dealership of your choice. Once you've selected your dealership screening location, select a screening time by clicking on the time slot that best suits your needs. To view additional screening times, you can click on the arrows at the bottom of the page. Verify that your screening appointment information is correct and enter your email address to receive a reminder for your screening appointment. Then, click Submit. This will bring you to your confirmation page. Make sure to print a copy of your free appointment date and time, or you can add the appointment to your Outlook calendar. To schedule your appointment at a Quest Diagnostics Patient Service Center, click Attend a Quest Patient Service Center. You will see 2 options, one to schedule your appointment and one to visit as a walk-in. Choose which option you prefer. If you choose to schedule an appointment, a list of Quest Diagnostic Patient Service Centers nearest to your home zip code will appear on the screen. Select a location. Next, you will be prompted to choose a date and time for your screening. Verify that your screening appointment information is correct and enter your email address to receive a reminder for your screening appointment. Then click Submit. This will bring you to your confirmation page. You will have the option to print out your confirmation statement and add it to your Outlook calendar. This completes the process of scheduling your screening. You also have the option to call Quest Diagnostics to schedule your screening at 1-866-697-8378. Their call center is open 24 hours a day, 7 days a week. After you schedule your appointment and your spouse's, you'll receive instructions on where and when to show up, as well as friendly email reminders. If you'd like additional details about the MSRP Biometric Screening Program, including brochures and frequently asked questions, these can also be found at www.msrp.net. Mark your calendar, sit back and relax. You're on your way to good health and great savings. Remember, your MSRP biometric screening must be taken on or before September 30th, 2014. Chapter 6. What happens if I don't pass the screening or use tobacco? Can I still earn healthy credits? If you do not pass your MSRP biometric screening and/or are a tobacco user, you can still get the healthy credits by visiting your doctor and/or completing the tobacco cessation course and submitting the required documentation by December 31st, 2014. Don't pay sticker price. Take action and get your screening today. Chapter 7. What if my spouse is not enrolled in my medical coverage? Can they still take the MSRP screening? If your spouse is not currently enrolled on your benefit coverage and you're thinking about adding your spouse to your medical coverage for 2015, please follow the steps below to register your spouse for him or her to be able to take the biometric screening. Go online to www.autonationbenefits.com. After logging on, click the icon, see what your benefits offer, and update beneficiaries. In the Personal Information page, review all the information to ensure it is accurate. Click Next. On the Review Dependent Information page, add your spouse as a new dependent and click Submit. Adding a dependent as pending does not add them to your coverage. During your enrollment window, you will be able to add your dependent to coverage. After you entered your spouse on the Benefit Connection website as pending spouse, wait 1 week for the eligibility file to be sent to Quest Diagnostics in order for your spouse to be able to make their MSRP biometric screening appointment. Chapter 8. What if I have more questions? Who do I contact or call? Information about the MSRP biometric screening, process, scheduling, healthy credits, and commonly asked questions and answers are available on the MSRP website at www.msrp.net. If you have questions on scheduling an appointment or regarding your screening results, please contact Quest Diagnostics at 1-866-MY-QUEST, 866-697-8378, and select Option 2, 24 hours a day, 7 days a week. If you have questions on adding a pending spouse, please contact the Benefit Connection, Monday through Friday, 8 a.m. to 8 p.m. Eastern Time, except holidays, at 877-550-2363.